Did you know that a medication sitting in your home right now, one you may have taken this week, could be silently damaging your heart without you ever feeling a thing? It sounds shocking, almost impossible. Yet, after decades of caring for older adults, I've seen far too many hearts weakened, not by age alone, but by pills people believed were completely safe. These aren't rare drugs or experimental treatments. They're everyday medications, pain relievers, stomach pills, cold remedies, supplements used by millions of seniors across America, often without a second thought. What most people over 60 don't realize is that the aging body reacts differently. A pill that once posed little risk can, years later, strain the heart, disrupt its rhythm, or slowly erode its strength. And the most frightening part, the warning signs are often quiet, subtle, easy to overlook until the moment something goes terribly wrong. Today, we're uncovering the truth behind 5 common medications that may be placing hidden pressure on your aging heart, drugs that could be affecting you far more than you've ever been told. Let's begin. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Non-steroidal anti-inflammatory drugs, NSAIDs, the silent strain that may be damaging your heart. For many older adults across America, NSAIDs feel like old friends. Familiar names like ibuprofen and naproxen sitting quietly in the bathroom cabinet, ready to soften the stiffness of arthritic joints or ease the aching back after a long day. They seem harmless, even comforting. But what most seniors never hear, and what far too many doctors fail to emphasize, is how these everyday pills can slowly place a dangerous burden on an aging heart. And the truth becomes clearer the older we get. What once felt safe at 40 can become a real threat at 60, 70, and beyond. The aging heart is different. It pumps more slowly, its muscle fibers stiffen, and its ability to handle sudden changes in blood volume weakens. When NSAIDs enter the picture, they disrupt the delicate chemistry that keeps your heart and kidneys working together. They cause your body to retain fluid, pushing more water and sodium into your bloodstream. For a younger person, this is an inconvenience. For a senior, it is a direct strain on the heart, like adding extra weight to an engine that's already been running for decades. Over time, that extra fluid increases blood pressure, thickens the workload, and forces the heart to stretch itself beyond comfort. For someone with hypertension, heart failure, or even mild age-related changes, this can silently push the heart toward exhaustion. But the danger doesn't stop there. NSAIDs narrow blood vessels throughout the body, including the arteries feeding your heart. That narrowing increases pressure inside the vessels, creating the perfect environment for heart attacks and strokes to occur. Many older adults take blood pressure medication every morning, trusting it to protect them. Yet, NSAIDs can weaken or even cancel the effects of those medications without any warning. One small pill can undo the protection of another. Most people never realize this until they feel the pounding heartbeat, the tightness in the chest, or the troubling shortness of breath that tells them something is wrong. For some seniors, the earliest warning signs are subtle. Swollen ankles that feel heavier than usual, fatigue that feels unexplained, a short walk to the mailbox suddenly leaving them breathless. Others feel nothing at all until a crisis occurs, and in the emergency room, too often the truth emerges. The medication they trusted to ease their pain was slowly damaging their heart, drop by drop, pill by pill. No one is asking you to live with pain, but if you are over 60, you deserve to know the reality behind these drugs so you can make wise, informed decisions. You deserve to know that safer options exist. Acetaminophen for mild pain, topical anti-inflammatory gels, or short-term NSAID use only when absolutely necessary. And you deserve a doctor who listens carefully when you ask, "Is this the safest choice for my heart at my age?" What may feel like a small decision, taking a pill for joint pain, can shape the health of your heart in ways far more powerful than most people ever imagine. And if a simple household medication can place this much stress on an aging heart, what about the drugs that were never meant for long-term daily use in seniors? The next medication on this list may surprise you even more, and it's one millions of older adults take every single morning without questioning it. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Proton pump inhibitors, PPIs, the stomach pills that may quietly disrupt your heart's lifeline. Across America, millions of older adults begin their morning with a tiny pill meant to calm the burning in their chest or protect their stomach from irritation. Omeprazole, pantoprazole, lansoprazole, familiar names, often taken for years without a second thought. They are marketed as gentle, reliable, and safe. But what most seniors never hear is that these same medications can quietly chip away at the stability of an aging heart, creating risks that grow more serious the longer the pills are taken. And because the effects are subtle, slow, and silent, the damage often goes unnoticed until the heart begins to show signs of struggle. The real danger begins with magnesium, one of the most essential minerals for keeping the heart's electrical rhythm steady and coordinated. Your heart relies on magnesium the way a musician relies on sheet music. Without it, the rhythm becomes confused, irregular, unstable. PPIs suppress stomach acid, and while that helps reflux, it also blocks your body from absorbing magnesium properly. For younger adults, the effect may be mild. But for seniors, especially those already facing age-related nutrient absorption issues, the drop can be dramatic. Too little magnesium can lead to palpitations, dangerous arrhythmias, and in severe cases, rhythms that can stop the heart entirely. And here's the frightening part. This deficiency builds quietly, month after month, year after year. Many seniors feel only vague fatigue, muscle cramps, or dizziness, symptoms easy to dismiss. Meanwhile, the heart is forced to operate without the mineral that keeps its electrical signals from spiraling out of control. What appears to be a harmless stomach pill can gradually begin damaging your heart from the inside, weakening the safety nets that protect its rhythm. But the concern doesn't end there. Some studies suggest that long-term PPI use may affect the flexibility of blood vessels by reducing nitric oxide, a molecule essential for keeping arteries relaxed. When those vessels stiffen, the heart must pump harder with every beat, placing an older heart under unnecessary strain. Over years, this strain may contribute to heart disease, reduced blood flow, and increased vulnerability to cardiac events. It is not dramatic or sudden. It is a slow erosion, the kind that older adults often never see coming until symptoms appear. Perhaps most troubling is how normalized these medications have become. Many seniors were told to take PPIs for life, even though these drugs were originally intended for short-term use. Without guidance, older adults continue taking them daily, believing they are protecting their health, not realizing the pill they trust may be quietly setting the stage for heart rhythm disturbances, nutrient deficiencies, and long term cardiovascular stress. If you are over 60 and rely on a PPI every morning, this is the moment to pause and ask your doctor the questions that may change your health's future. Do I truly need this long term? Can I taper safely? Are there other ways to control my symptoms without risking my heart? Because if a so called stomach protector can harm the very organ that keeps you alive, you deserve to know what else might be hiding in your medicine cabinet. And the next drug on this list may shock you even more because it's something many seniors reach for during nothing more than a simple winter cold. 3. Oral decongestants, the cold medicine that can squeeze the life out of an aging heart. For many older adults, a stuffy nose seems like a small inconvenience, an annoyance that comes with winter weather, allergies, or the changing seasons. It feels harmless enough to walk into the nearest pharmacy and pick up a familiar cold medicine containing pseudoephedrine or phenylephrine. These pills promise quick relief, the ability to breathe again, and a return to normal comfort. But what thousands of seniors across America don't realize is that these seemingly simple decongestants can place overwhelming stress on an aging cardiovascular system, creating dangers far more serious than a seasonal cold. As the body ages, the heart must work harder to maintain steady blood flow. Arteries become less flexible, blood pressure tends to rise, and the heart's electrical system becomes more sensitive to sudden changes. Decongestants exploit this vulnerability. They work by constricting blood vessels in the nose to reduce swelling, but they don't stop there. They constrict blood vessels throughout the entire body, including those that supply blood to the heart and brain. For a younger adult, this increase in pressure may be manageable. But for someone over 60, especially with hypertension or even mild heart disease, this sudden tightening can be dangerous. When blood vessels narrow, the heart must push harder than before. The pressure inside the arteries rises sharply, sometimes within hours. Many older adults describe a sudden pounding heartbeat, a sense of pressure in the chest, dizziness, or a feeling as if their pulse has become erratic. These are not simply cold symptoms. They are signs that the heart is struggling under the weight of a drug the body can no longer tolerate. Left unchecked, that strain can begin damaging your heart, weakening its ability to pump efficiently. In severe cases, it can trigger arrhythmias or drive blood pressure high enough to place someone on the edge of a heart attack or stroke. What feels like temporary relief for the nose can quietly destroy your heart's stability. And these risks are not just theoretical. Emergency rooms across the country see older patients every winter who arrive breathless, frightened, and confused, never imagining that a common cold medication could send their cardiovascular system into crisis. The most unsettling part is how accessible these medicines are. They sit on open shelves, no prescription needed, no conversation with a pharmacist. Seniors assume they are safe because they've been around for decades. But the truth is that the aging heart does not respond the same way it once did. What felt harmless at 50 can become genuinely dangerous after 65. The safest path is awareness and caution. Older adults should avoid oral decongestants entirely and choose alternatives that relieve symptoms without affecting the heart. Saline sprays, humidifiers, gentle nasal corticosteroids, or guidance from a physician who understands the complexities of senior health. But if a simple cold medicine can push an aging heart into dangerous territory, Imagine what a certain class of older antidepressants, still used for nerve pain and sleep, might do to the rhythm of a vulnerable heart. The next drug on this list carries risks that many seniors have never been warned about, yet its effects can be even more unsettling. If you're still watching and finding these insights valuable, please comment number one below to let me know you're here. Now let's keep going with point number 4. 4. Tricyclic antidepressants, the older medications that can quietly disrupt and destroy the heart's electrical balance. For many older adults in America, tricyclic antidepressants, medications like amitriptyline and imipramine, entered their lives not for depression at all, but for nerve pain, sleep problems, or chronic discomfort that seemed impossible to manage. These drugs have been around for decades, long before today's safer alternatives existed. And for many seniors, they were prescribed at a time when the long-term risks to the aging heart were not fully understood. But as the years pass and the body changes, the way these medications behave inside an older adult can shift dramatically, turning what once seemed helpful into something far more dangerous. Tricyclic antidepressants affect the heart in ways that matter deeply to older adults. As we age, the electrical system that keeps the heart beating becomes more fragile, more sensitive to disruptions in rhythm and blood pressure. These older medications interfere directly with that electrical conduction, slowing impulses that should move smoothly through the heart's chambers. What begins as a subtle delay can gradually develop into a rhythm disturbance, skipped beats, sudden pauses, or chaotic patterns that make the heart feel unsteady. For a senior, those sensations are more than uncomfortable. They signal that the heart may be struggling, operating without its natural rhythm, and edging toward the kind of instability that can damage your heart silently over time. But the danger doesn't stop with electrical interference. These medications can also cause a sharp drop in blood pressure whenever a person stands, a condition known as orthostatic hypotension. For someone younger, it might mean momentary lightheadedness. For someone older, it can mean a sudden fall, a fractured hip, a hospitalization, and long-term physical decline. Every cardiologist knows that falls in older adults can destroy your heart's future, not just physically, but emotionally, because once mobility is lost, the entire cardiovascular system weakens rapidly. Tricyclic antidepressants also raise resting heart rate, forcing an aging heart to work harder even when the body is at complete rest. This constant elevation may seem small, but over months and years, it places continuous strain on a heart that already faces the natural stiffening and reduced elasticity of aging vessels. The heart becomes overworked, tired, and vulnerable to further disruption. These small stresses accumulate, opening the door to complications that can damage your heart in ways that are slow, silent, and deeply destructive. What makes all of this even more troubling is that many older adults take these medications without knowing their cardiac risks. They trust them because they've used them for years, or because they were prescribed for something as simple as nerve pain or restless nights. Yet inside an aging body, these drugs can behave like hidden saboteurs, altering rhythm, lowering blood pressure, and forcing the heart into patterns it was never meant to endure. And if a medication this old can interfere so profoundly with the heart's electrical system, imagine what can happen when a supplement millions of seniors take every morning may be quietly altering the very structure of their arteries. The fifth item on this list is perhaps the most surprising of all, because it looks nothing like a medication, and yet its long-term impact on the aging heart may be far greater than most people have ever imagined. 5. Calcium supplements, the daily pill that may quietly harden and damage the aging heart. Across the country, millions of older adults begin their morning with a familiar habit: a calcium supplement taken with breakfast, meant to strengthen bones and protect against fractures. For decades, this has been seen as a smart, responsible choice, something every senior should do to keep their bones strong. But in recent years, researchers and cardiologists have raised a warning that many older adults have never heard, a warning that deserves attention. When taken in large doses or without medical oversight, calcium supplements may contribute to harmful changes inside the arteries, changes that can quietly damage your heart over time, and in the most vulnerable individuals, help destroy the very blood vessels your heart depends on. As we age, calcium metabolism becomes more complex. The body absorbs it differently, bones take it up more slowly, and the cardiovascular system becomes more sensitive to sudden shifts in calcium levels. When calcium comes from food, it enters the bloodstream gradually, allowing the body to use what it needs and filter out the rest. But when calcium arrives all at once in the form of a concentrated pill, blood levels spike quickly, faster than an older heart and older blood vessels may be able to handle. That excess calcium doesn't simply disappear. In some cases, the body deposits it into artery walls, creating tiny hardened spots that build over the years. This process, known as arterial calcification, is deeply concerning for seniors. These hardened deposits make arteries stiff and less flexible, forcing the heart to pump against increasing resistance. Every beat becomes a little harder, a little more strained. Over time, this extra workload can age the heart more quickly, wearing down its strength. For older adults who already live with hypertension, diabetes, or plaque buildup, this calcification can accelerate the narrowing of arteries, placing them at higher risk for heart attacks. It's not dramatic at first. It starts quietly. A little less energy on morning walks, a heavier feeling in the chest after climbing stairs, breathlessness that seems new, subtle, easy to dismiss. But beneath those symptoms lies a system slowly changing in ways that can damage your heart far more than most people imagine. Some studies have shown a small but notable increase in heart attack risk among individuals who take high dose calcium supplements. Others show no effect. That inconsistency is what makes this issue so unsettling. The evidence is not absolute, yet the potential for harm, especially in older adults already at risk, cannot be ignored. And the uncomfortable truth is that many seniors take calcium supplements without any medical guidance, believing more is better. But with calcium, more can be damaging, and too much can slowly destroy the flexibility and health of your arteries. The safest approach is not to avoid calcium, but to get it wisely, from food whenever possible, and from supplements only when your doctor confirms you truly need them based on bone density testing and overall cardiovascular health. And if something as simple as a supplement can raise these concerns, it leads to a deeper question. What does all of this mean for the medications and health choices older adults make every single day? Final summary: the truth your heart needs you to understand. After exploring these 5 hidden risks, one truth rises above everything else. As we grow older, the medications we once trusted can affect our bodies in profoundly different ways. Age changes the heart, stiffens arteries, slows kidney function, and alters how drugs are absorbed, processed, and eliminated. What was harmless at 40 can become far more dangerous at 70. And because these medications are familiar, sold over the counter, prescribed casually, or taken for years without question, Older adults often underestimate their power, but your heart never underestimates it. Every pill you take becomes part of its daily burden, shaping its rhythm, its strength, and its future. This does not mean you should fear every medication. It means you should understand them. It means recognizing that even common pills can damage your heart when taken without guidance, taken for too long, or taken in doses never meant for older adults. It means acknowledging that your heart, after decades of loyal service, deserves careful, deliberate protection. And it means speaking openly with your doctor, bringing a full list of your medications, asking brave questions, and refusing to let convenience outweigh safety. Your health is not built on a single decision. It's built on awareness, on asking the right questions, on paying attention to the signals your body sends. Most importantly, it's built on understanding that you are not powerless. Every choice you make, every pill, every routine, every conversation can either protect your heart or place new strain upon it. You deserve a future where your heart remains strong, steady, and supported. And now that you know the hidden risks, you are already one step closer to safeguarding the most important organ you have. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.